There's a patient who had suffered a stroke. He's been non-braceable and hasn't been able to walk now for a couple of years. He had a huge deformity where his foot was turned all the way in and just couldn't walk. You couldn't even turn it around to brace him. And we did this huge reconstructive surgery, straightened his foot out, fusion tendon transfers, things like that. And the patient stands up for the first time and actually has a straight foot on the ground and just starts bawling. When you take someone that can't even walk and you give them a foot to stand on, it's awesome. It's just so cool. I love it. It melts your heart. Hi, my name's James Maskill. I'm a foot and ankle specialist. I'm seeing patients in St. Joe. I'm with Community Bone and Joint. My family is up in Grand Rapids. Come from a bigger family, 4 other siblings. I've lived here for most of my life. However, I've been to Chicago, San Francisco, and Portland, Maine for training. I am married to my beautiful wife, Alex Maskill. We've been married almost 9 years. We have an 8-month-old baby girl. Her name is Ashlyn. Excellent patient care is explaining to the patient what is wrong. And I don't like to leave the room unless they have an understanding of why they hurt, what is causing them to hurt, and the biomechanics of what's wrong with their foot. If they understand, they'll do what you ask them to do, and it makes sense to them. If they don't know why they're going to get an orthotic, if they don't know why you're doing this and this surgery, I don't think the outcomes are as good as someone that has a full understanding of what they're getting into. So I was taught to explain things and have the patient understand, because I think that's a big part of patient care. I can think of this one instance where this guy, young active climber, fell 20 feet and just completely shattered his ankle like 100 pieces basically. Didn't know what was going to happen. Is he going to be able to walk again, climb again? The surgery went phenomenal, and he ended up recovering, doing the appropriate things post-operatively. We saw him back at 6 months, and he was like basically crying in the office, thanking us, and it was just like, that's what it's about. Getting the patients back at least to where they were at their activity level or even active is just so awesome to see. That's why we do what we do, is helping patients, and seeing that is just a perfect confirmation of why I do what I do.